All right, let's get started. Thanks for joining us, everyone, here on Zoom and on Facebook Live. We're here for the Invincible Health Series with Dr. Vin, as always. My name is Krista Gervon, and I'm the Communications Director at Princeton Integrative Health. And we've been doing brain health a lot throughout this series. So we're going to continue with brain health this week, and we're going to focus today's topic on dementia. So, Dr. Vinny, can you just give us a kind of a brief overview of what exactly is dementia?
Well, that's about a 3-hour talk, or maybe a week long, or
Yeah, 35,100 view.
all right. Yes. So dementia is usually used to describe when people start to lose portions of their memory, and then actually lose the ability to perform some of the activities of daily living sometimes. So that's the kind of the overall view.
Right.
You can think of it as you lose parts of your brain function. The nerves aren't properly working to retrieve memories and that kind of thing.
Yeah.
And that can be due to a number of different things.
Right. So I think most of us, when we think about dementia, we're thinking it's an issue that elderly people usually have. But what are some of the causes that can make dementia appear in others too?
Yeah, so I mean, right, we all think of elderly folks, we all talk about those senior moments that we get, I don't remember why I walked into the room,
Right.
or, oh, geez, I can't remember that word. That happens to all of us. That's not what we're talking about. We're talking about serious issues with people retrieving memories, sometimes not even realizing that they don't have the capacity anymore.
Mhm.
But yeah, it can, the contributors to dementia are things like inflammatory conditions, things like diabetes can be a contributor, toxins can be contributors. We live in a very toxic world nowadays, so we have to, be very careful about that. Uh, Things like nutrients and hormones can contribute, lack of nutrients, lack of hormones can contribute to dementia.
Mhm.
What we call vascular dementia, where the blood vessels might not be working, getting enough blood to the brain, if
Right.
you will. And sometimes serious head trauma can lead to dementia somewhere down the line.
Yeah.
But over the next month or so, I think I'm going to take each one of those contributors, and maybe each week we'll talk about one so we can get more in depth, get a better view of each one, so people can have a better understanding what causes all the contributors to dementia, and then know what to do about each of those also.
Yeah, and if anyone's been kind of following all of these series, and even the series I've been doing with Dr. Connie, there's patterns in all of these, where you're seeing what types of the inflammatory diets and things like that, how they contribute to all sorts of different problems later on in life. So, there is a common thread of the information that's coming through in these topics, I think.
Yes.
And coming from an integrative health practice, you know, it's an integrative body. All these systems are woven together, and whatever we're putting in our body or not putting in our body makes a difference in all the different systems. So we're seeing that again and again in all the different topics we're covering. You did mention that there's senior moments, and that's something that we all kind of have at some point in our lives. So what are the signs of dementia that are different than just those senior moments?
So often it's, more severe things like somebody goes out to the store that they've been to, most of their life, and then they can't remember how to get home. I mean, that's more, you can tell that's more than a senior moment that
Right.
people are having. You know, what else? Yeah, getting lost in general on when you're in a familiar area. I mean, if you go to a new city and you get lost,
Right.
that's one thing. But getting lost anywhere, in a place where you should not get lost is one of those signs. You know, or what happens sometimes, people just keep repeating the same story over and over again, or ask the same questions over and over again in a short period of time,
Yeah.
not like, you know, they tell the same story at Thanksgiving and Christmas,
Yeah.
but more like, they tell the same story 3 or 4 times at Thanksgiving.
Oh, I see.
Not
Okay.
remembering
Yeah.
that they told it before, or people ask you a question, and like 5 minutes later they ask you the same question, and then 5 minutes later they ask you the same question.
Got it. Okay.
Those are signs that they're not able to form those short-term memories.
Right.
So it's more severe things like that. I get a lot of questions from people, as I said, with those senior moments. They especially if there's a family history of dementia, they come in and say, geez, I couldn't remember where I put the car keys the other day. I'm like, yeah, neither can I. So, so don't worry about that. As long as you can remember that you couldn't remember where the car keys were, you're probably okay. But once you start to lose that capacity to remember, geez, I couldn't remember that, then that's usually a sign that something else is going on.
Got it. Okay. Yeah. Because there's always, I feel like, moments when we're multitasking and doing a million things at once, and we're trying to remember all of our things that we have in our schedule, and you're bound to forget eventually because we all have very busy lives. So it's beyond that, normal forgetfulness.
Yep.
So what are ways that we can prevent dementia? Is there a way to prevent dementia?
Yes, there is.
I'm so glad I asked.
You mentioned the themes that we talked about before, and as I said, in the next probably 6 weeks, I'm going to get into the more specific causes of dementia and what you can do for each one. But I mean, generally overall, it is eating a well-balanced diet, anti-inflammatory diet, lower in carbs and sugar than the typical American diet. That's probably foundational. A lot of good plant nutrients, organic as much as you can, making sure you get some fish oil, fatty fish in there if you can eat fish. And so there's that. Getting good sleep. Most people say 7 to 8 hours. Making sure you don't have sleep apnea. Being active, trying to be active at least 30 minutes every day, going for a walk, that kind of thing. 30 to 60 minutes a day is ideal. Let's see. And finding ways to manage your stress is very important. We all have stress in our lives. It's how we manage it, how we let it affect us. If it's affecting your sleep, so you're not sleeping well, that's not a good thing. It's finding ways to deal with that, whether that's meditation, whether that's yoga and Tai Chi, whether that's reading a good book, whether that's crocheting, whether that's putting on boxing gloves and hitting the gym and pounding on the boxing dummy, whatever, however you can relieve your stress and keep it to a manageable level is great. And so that's the foundation of many of the things we do. And as I said, we'll talk a little bit more in depth on all the different subtypes of Alzheimer's disease as detailed by Dale Bredesen, which is what we base our program in the practice on. And if people don't know Dale Bredesen, he wrote a book called The End of Alzheimer's, where he lays out a very convincing case that Alzheimer's is a preventable illness and that we should be able to end it. There's no magic pill, though. You have to do the work.
Yeah. My grandfather had Alzheimer's, and I was going to ask you if there was a difference between the two. One day I got into his car and I pulled up to pick him up. We were going to a restaurant, and he got in the car and he said, "It's a nice car you have." And I said, "It's your car." And he had no idea that it was his car. And it had been a little while since he had probably driven it, but is that sort of the same thing that you were talking about earlier?
Yeah, right. Right. Somebody with a normal memory, not demented would remember that. Even if they have senior moments, they should remember that. But he wasn't able to keep those memories formed. It was probably recent enough for him. For most people with dementia, it's more the recent memories. The long-term memories usually stay, so they remember this. That's why the stories are usually from 20, 30 years ago, because those are laid down well in long-term memory. But those things that that new car that maybe was 1, 2, 5 years old even, they may not remember because they just can't keep those memories formed, or they can't retrieve those memories.
Yeah, he thought it was very funny. He thought I was like joking the whole time. I was like, no,
Yeah.
your car. But anyway, what are the ways that we can treat dementia once it's onset?
Yeah, so the important thing is to get a good evaluation. That often includes some cognitive testing, maybe an imaging study like an MRI, a lot of history taking, and usually a laboratory evaluation, so we can figure out what are the contributors to the dementia. And then it's addressing those specific contributors. And that's something that as I said, we're going to get into more starting next week.
Okay.
But again, the foundation of all of that is what I mentioned before, the taking care of your diet, your exercise, activity, taking care of stress and getting good sleep. That's foundational, because if you don't have those things, no matter what else you do, you're not going to make any progress. So those things are key. And the drug companies are spending billions of dollars looking for that magic pill that's going to reverse dementia. Over the past 10 years or so, they've tried 244 drugs, and like one of them has been approved, and that just offers a temporary reprieve of maybe months, maybe a year or two, kind of slowing things down a little bit, but the ultimate progression is the same. But we're talking more using more integrative and functional medicine, looking for root causes and addressing those. And that has much more power to stabilize and prevent for people. Because the other thing we want to do is not just treat people who have dementia, but we want to find people before they have dementia, so that we can actually truly prevent people from having it. And there's a lot of good evidence that you can do that. So and that's why Dale Bredesen wrote his book, because he wants to make this the last generation of people that actually has to suffer from dementia, make it a much more rare cause of illness and death. Dementia is the number 6 leading cause of death right now. And if we don't do something, it's going to end up costing the country trillions of dollars for all those people going into nursing homes and things, and ungodly amounts of tragedy for families and things. So we really want to impact that. And
I mean, this is why we're doing these educational series, just to drive home the point that there is a way to prevent and then even reverse once someone is struggling with a certain challenge, dementia or whatever it is that we've been talking about over the past few weeks, so that we can prevent it from happening.
Yeah.
And you mentioned we're going to go into more specifics over the next few weeks. Do you want me to give a sneak peek of what next week might be?
Yeah, next week we're going to talk about inflammation, how inflammation contributes to dementia. We'll talk about the different, where the different areas where inflammation could be coming from, and what people can actually do about that. So, I hope anybody who's listening, tunes in next week. Get friends and loved ones on who could benefit from this information, because it's going to be some good information.
Yeah, it's always interesting when we get into the more detailed topics. But if anyone does have any questions for Dr. Vinny right now, please feel free to type question in, or you can unmute yourself. I'm going to go see if there's anything on Facebook in the meantime. But yeah, please feel free. Is that in? No questions on Facebook. So wanted just to thank everyone for watching and joining us today. And like Dr. Vinny said, we're going to really get into a lot of the details regarding the causes of dementia in the next few weeks. So be sure to join us here at 4:30 on Thursdays to learn more. Lynn Schwartz says, thanks for sharing the info. So
Thank you, Lynn. Nice to
and you're
see you.
welcome.
At least your name there.
Yeah, so we're happy to share all this information. We're glad you're here to hear it and to share it. This video will be on Facebook. You can share it with anyone who might find value in it. It'll also be posted to YouTube within the next 24 hours, where you can find all of Dr. Vinny's past episodes also. So if you need to catch up anything like that, we have a YouTube channel that I will, you know what, I'll just post it right now. 1 second. Because I did make a whole playlist so that it's easy to find. And then people can watch all of them right there. Sorry. Here. All right, let me just pop it in there. And there it is for everyone. And otherwise, we'll see you next week at 4:30 for the next episode of the InVINcible Health Series. Thanks, Dr. Vinny.
Thank you, Krista. Thank you, everyone.
All right, we'll see you soon, everyone. Bye-bye.